Good day to you all. My name is Nurse Shazali Yau Mani, and I'm going to make a short presentation for you today on the topic, who is a nurse? So who is a nurse? You must have your own definition, but let's see. A nurse is defined or can be defined as a licensed healthcare professional trained to provide care, support, and advocacy for individuals, families, communities in an attempt to achieve, maintain, or recover optimal health and quality of life. So by this definition, we mean that there are various things that nurses do, which include supporting care, advocacy of individuals, families, and communities. A nurse works for individual, whether in healthcare setting, at home, or any setting, work for community, work for the family, and the attempt is for the nurses to help them in achieving, maintaining, or recovering optimal health and quality of life. The core functions that nurses perform include providing patient-centered care. This usually takes place in hospital or healthcare setting, where nurses do take care of a patient individually, that is individualized patient-centered care, which include also administration of medication. Administering medication is part of the major function that nurses do, and treatment of other elements, monitoring patient progress and documenting care. We monitor patient progress, we document the care we serve, or nurses document the care provided to the patient. Likewise, educating patients and their families about health and wellness. Patients are not only the concern of nurses, but rather including their relatives. As a professional nurse, there are qualities that a nurse is supposed to have, which include being very compassionate. Compassion is part of the qualities of a nurse, because nurses care for patients in their most vulnerable moments, so there is need for compassion. Likewise, effective communication skill, for the nurses to be able to communicate effectively with the patient, with the families, and with other colleagues who form the healthcare team. Critical thinking is another key quality that a nurse should have. Critical thinking talk about ability to make accurate decision during emergency. Nurses need to always be resilient as well. Resilience, that is the ability to manage stress in high pressure environment. There are various types of nurses, but commonly here we talk about registered nurses, those who are licensed and registered to take care of a patient, including patient education, support to the patient, among others. There are those that we call licensed practice nurse or enrolled nurses, whose basic care is usually providing basic function, providing nursing care under the supervision of nurses, that is the registered nurses. There is nurse practitioner, or usually what we call advanced nurse practitioner, who diagnose and treat illness. Also, there are various specialized nurses, which include midwives, who are specialized to take care of mothers or pregnant mothers and their babies, pediatric nurses, who usually take care of children, critical care nurses, and community nurses. Then we also have educational pathways through which someone becomes a nurse. Commonly, diploma in nursing, which is usually in the hospital-based nursing system that is now being paid out in Nigeria. Then Bachelor of Science in Nursing, which is usually obtained from university or from colleges that have affiliation with universities. We have advanced degrees like masters. Nurses do go for masters in nursing sciences or masters in different field of nursing. Doctorate degree also, like PhD, usually for specialized or leadership role. Nurses do that, and as well as continue education to enhance their knowledge. There are so many important things that nurses do, especially in healthcare system. So nurses are very important in healthcare, especially in the aspect they provide or they serve as patient advocate. Nurses act as the voice of the patient in healthcare setting. Healthcare team integration, they bridge the gap between doctors, patient, and other medical staff. Public health contribution to the community education, vaccination campaign, and disease prevention program. Likewise, providing emotional support, helping patients and family navigate difficulties in difficult healthcare situations. Nurses do this to ensure that the patient's well-being is ensured. Also, we look at the challenges that nurses face. Part of the challenges that nurses face worldwide include workload overload. We have high patient to nurse ratio that can lead to burnout. You can imagine one nurse taking care of 20, 30, 40 patients in the hospital. Emotional strain, that is handling patients suffering loss and emergencies, are part of the key challenges. Safety risk, exposure to infectious diseases and workplace injuries. Likewise, recognition, despite being the backbone in healthcare profession, the contribution nurses are usually underappreciated. There are so many complaints, so many things that people do say about nurses. Anyway, global impact that nurses usually found to have include universal healthcare goals. Nurses are pivotal in achieving the World Health Organization goal for universal health coverage. Role nurses play in pandemic is of paramount importance, notably seen during COVID-19 pandemic. Likewise, nurses serve as cultural ambassadors because they provide care irrespective of the background of the patient culture, being sensitive also to the patient need and providing diverse care to the patient. Inspirational fact about nursing. Every nurse knows about Florence Nightingale, the founder of modern nursing, known for her work during Crimean War. Also globally, nurses made over 50% of the healthcare workforce, and as well as being trustworthy professionals. This is very important. Nurses are regularly ranked as the most trusted profession in public survey. So as nurses, we need to uphold this integrity. In fact, there are many more. You can tell us more of the impact that nurses make worldwide. But these are just few keys that we take as a sample. Nurses are very important in healthcare profession worldwide, in the community, family, everywhere. Call to action. There is a need to recognize nurses. Help us celebrate. Help nurses celebrate with them, especially on the World International Day for Nurses, which is usually celebrated on May 12th. There is a need to support future nurses. Advocate for better training opportunities and workplace conditions, better payment. Let's appreciate our nurses. Let's work for and support nurses to have a better working environment, because if a nurse is happy, the patient is going to be happy, and the vice versa. Join the profession also to inspire individuals. Consider nursing as rewarding. You need to allow your babies, allow your children, allow your female and male children to join nursing profession, so as to have enough to take care of the community, family, and the world at large. These are a few things about nurses. If you are a nurse or you have encounter with a nurse, please make your contribution to us. Let us have more. Let's hear from outside. What do people are saying, or what do you think about nurses? And this make you understand or agree with what is or who a nurse is? Please let us know. Thank you.